Well, therapy is so there's certainly different levels of therapy, and so we're gonna stay away from the intense psychiatry kind of therapy. That's not a realm that now you're getting into medications and you're getting into severe depressive type episodes or some real dangerous behaviors that need a little bit more attention along those lines. And so we're going to stay a little bit certainly below that. Therapy is a huge benefit, and if you find the right therapist, it's like anything else, is finding the right therapist. Um, Therapy is designed to get you in a position, however long it could take, depending on what your issues are, or what you're dealing with, your traumas, or what you've just gone through just now with a relationship or a breakup or a death, grieving, all of those things. And there's also therapists that specialize in all of these things: grief therapy, relationship therapy, marriage therapy, family therapy, drugs and alcohol, recovery, addiction. There's a lot of specialization in it. So it again, it's doing your own research and finding someone to help you. This is what you're trying to do. Therapy is to help you get yourself in a better position to move forward without all of what is causing you and causing problems in your life now. So, for example, if you did just go through a breakup, and so it's really been hard. You're This person was a big part of your life, a big focus. You put a lot into it. You may have left a job for it. You may have moved across the country for it. You may have done all these other things that made it more intense. And a lot of that is more what has to do with you. So this goes to with therapy. Again, you're not going there to try to fix the other person or try to come up with some better techniques to handle somebody like that next time. Therapy is for you to understand why you're dealing with it, why you're having a hard time, why you would continue to pursue someone that doesn't want to have a relationship with you. These are great opportunities for you to understand where these things come from and these feelings. So if you want to have a relationship in the future, or get into a relationship in the future, you will be better, know how to handle things better. You'll be able to see red flags that come up, and you'll be able to pay more attention to the behaviors that are just that bring you to a you know maybe being a little bit more destructive in your life, or giving yourself up for someone else, which is never going to work. So a therapist is to work with you to help you come up with a plan, identify some things you may not be able to see at the moment, to help you come up with a plan to deal with things, whether that's jumping back in your past a little bit. Why is there a connection with this, with a parent or a different relationship? And maybe understanding that it's over. It's not anything you need to be bringing into the present, and help you work on that, whether it's journaling and things like that. And that leads into your question a little bit about cognitive behavioral therapy. So a couple of things here. There's cognitive behavioral therapy is what is mostly used with PTSD. A lot of our military, so a lot of those are going through that particular type of therapy, because it more is to address what is causing problems in your life right now, and getting a handle on exactly what those are, how they're affecting you. And then if you got to go back in the past for a minute because you've connected the dots that you have these feelings or the lack of self-worth with men because of the way your dad treated you or whatever it is, you go back and understand, that happened, but it's not you. As other messages or whatever happened, you reconcile it, and then you're able to quickly come back to now and know how to deal with things differently now and things you need to work on. So you go forward in a very positive, higher self-worth, higher, more equipped to, again, handle things in the future. That's what cognitive behavioral therapy is a lot about. The other things, more intense ways that I used it, was cognitive behavioral therapy has what's called thought pattern interruption. And I still probably use that hundreds of times a day sometimes. Thought pattern interruption is, again, is immediately attacking a negative thought that comes in your brain. You don't let it linger. What you're working to do is get into a place that going forward the rest of your life, the chances of that critical voice or whatever trauma you went through, demons, whatever you want to call them, just completely going away, especially when something stressful comes up and they start pounding on you. Oh, you can't handle this. You're dumb. Of course this is going to happen again. All that stuff is going to come back up when things get stressful, or again, that breakup comes, or someone, passes, whatever it could be. So thought pattern interruption does not allow that to set in. And that's what's very important is, again, that negative thought comes up as you attack it no matter what, and you don't stop until it's gone. You can call it whatever you want. I kill mine. You can, wait till it's gone, it's silenced, whatever. I don't make, there's no, when cognitive behavioral therapy, making friends with your demons or your voices, or dancing with them, or understanding them, or working with them. You want that doesn't work. You have to immediately tack them and squash them. But it's thought pattern interruption. That was a big deal for me. The second thing is the journaling. And the journaling is, again, where the part is this is a great opportunity for you to find things a lot quicker when they are happening. In other words, I mean by find things is finding out where it comes from. And a lot of times you don't. And remember, just like anything tangible or something is broken, you can't fix it unless you know where it comes from. So that's what journaling does. And cognitive behavioral therapy is a big supporter and pushes journaling, or certainly that's what I got out of it, which has been huge. Another huge step for me is again, the journaling. And again, I'm going to break it down again so I don't keep repeating myself, but the connecting the dots. So when you journal, it's like you're dealing with, again, someone, you're grieving over someone. Okay, whether it is a huge breakup, a marriage for 20 years, or it's a death, whatever, but you're really grieving that relationship. And it's really hard to move past it, and it's disruptive in your life and everything like that. So when those things come up and you start feeling that deep sadness, and you pull your journal out, no matter where you are, you carry this journal, you pull it out, and you start writing what you're feeling. And then you also can come up with a checklist. There's a lot of ways you can find checklists online. You can try to find some things to start with, but you develop your own checklist. Where am I right now? Who did I just talk to? What did I just eat? What's the weather doing outside? You do that, and over a period of time, whether it's a few weeks even, or it could be a few months, you're able to go back and look through all when these things happen, and you're able to see where some of these triggers are. And a lot of times it is maybe who you talked to or who you bumped into, or maybe you're revisiting places that maybe you need to find another store to go to that's down the street. Whatever could be happening, you start finding those dots to connect. And then you can go, and you can understand why, what could have occurred at this store that maybe, gets you in that feeling that, whatever. So that's a big piece too. So that's why I'm a firm believer in cognitive behavioral therapy. It's very active in moving you forward, giving you tools and techniques to do that so you can become, again, to me, cognitive behavioral therapy is built for my message, which is being a self-care savage. It is, again, how do we, and cognitive behavioral therapists, usually with treatment plans or whatever they develop around you, that one of the top goals is is getting you as fast as they can into being able to handle and deal with things in the future yourself, self therapize, whatever you want to call it, and not having to rely on somebody. I always say, I make this one, analogy just to kind of give, a context of that. It's like, look, a therapist, you're not going to, Christmas morning or whatever, holidays you celebrate or whatever big events or things like that happen, and something occurs that triggers you, and you're in a panic, and then you're starting to sweat, and then you're kind of losing, what you need to do. That therapist is not just going to be right there, or be a phone call away, or be able to respond to something. So the goal again is to get you to, okay, here come these feelings. I've worked on this. I know where they come from. Here's what I need to do. I need to remove myself from this situation. I need to drink this or make sure this, whatever, to get yourself back centered and understanding this is not something you need to, but this is not something you need to let go further. Again, the point is to be able to stop these things before they set in and take you down those paths that never are beneficial to you. And they're not real most of the time. And they're just based upon things that are done and over with, or things that haven't even happened. So, again, that's again, trying to give you what I think is good about therapy, and then connecting cognitive behavioral therapy. I'm not saying that's the best thing for you. I always tell people to do your research around it. But that's what's worked for me, because I want, I really wanted to be able to handle things, on my own. And I needed all the tools that I could do to do that, because what I was dealing with was an everyday, all day thing. And and I lived that victim life every morning, waking up, being stressed. What do I have to fix from yesterday that I broke? What did I lie about that I had to cover up, to make sure that this doesn't happen? Just that life of just all of that. And, this was a way that, again, I could go after it hard and fast, and it felt good and it felt right. And it gave me, again, these tools that I could understand, because I want to fight, for myself, and I want to fight those things. So again, I know I'm getting a little bit off, but that's what therapy is good, is really good for. Therapists are very important, finding the right therapist. I think everybody can benefit from therapy if they're not using that as the fixer. If they're not, again, it's real hard to speak, exactly for anybody and everybody. It's real hard to know what people go through. It's real hard to know has a lot to do with the physical part, the physiology, I think is what it's called. A lot of people, have phobias, and they have OCD. They have all these things that are very disruptive in their life, and they may just be something that got developed through them growing up as a child. Something really had nothing to do with somebody dealing with them, but something they observed, and they just always wanted to avoid it. There's all these different things. So anybody that is having an issue mainly with their daily life, and there's just things that are always interfering with their decisions, how they operate, how they act and react to people, it's absolutely, therapy is great for that, because obviously you're doing that because you are not understanding maybe why you're doing that. You're not able to easily go back and work on it, or understand what you even need to work on. So even the littlest things can turn into really big things as you go on. So And sometimes it's not until something tragic happens, or again, that death or that big breakup of that relationship or whatever, until that may trigger that. So it's hard. It's therapy's not really designed to where, and no, if you're very healthy and you have done a lot of work and a lot and I have a real good understanding of yourself, and you don't let things set in. You're not someone you understand that what's happened, and you can either carry that and let it continue to affect you, or understand that it's a learning, and you're just naturally one of those people. There are people out there that are naturally able to take care of themselves. So, but across the board, yes, therapy is available for anybody. Uh, and also tying in like relationships, again, marriage counseling, even family therapy, at any level and stage of life. All of those things can be very beneficial in helping, get a better connection, to not, again, I don't, it's hard to use exactly what words, but, lots of relationships are crushed, and there's breakups and there's things that happen because people, it's just scary to go and think to go into a counseling with someone else, even if you're married to them, even if you've been married to them 10 years, that you're still full of a lot of shame and things that you haven't even talked about. So it's become real easy to to make the decision not to. It's less painful, believe it or not, to have to go in that environment, work on those things, than it is to actually lose someone. And people choose that a lot, and so there's so many different levels for it. And again, I can't stress enough how important it is. You therapists are they work for you. And again, I have a lot of experience from childhood with my mom, moving through the process of becoming a therapist, and working out of our home and doing all that, being exposed to it continuously, her being very unethical in the sense how she brought that into our lives, and all these people were our friends, and she, it was really, it was, those are not good things, and I wouldn't recommend finding a therapist like that. Even though she was great at helping people, it's not appropriate as far as that goes. So you just have to find and interview those people and understand that, again, they work for you. They're there to help you with what's going on with you. And if you're not comfortable with them, or you're not feeling it, or there's being no progress made, this is where you have to take care of yourself, and take charge again of your treatment plan. You have to become an administrator, and you have to hire these right people, go to these right places, groups, go get involved with whatever helps you manage you being as healthy as you can, being better for yourself, so you have more peace and happiness, and you can let that ooze on to everybody else. I mean, that's overall the goal from an individual to being a member of society. You know. Oh, absolutely. Yeah, and again, therapy can be a little bit difficult to find somebody, and that's why sometimes you have to be prepared to go through, one or two, but and also being, recognizing that you need to let some things go that you may not particularly like, but they're not a red flag. They're just maybe something, but that's also something that can be very beneficial, is learning how to listen to somebody give you some critical information that you may not be, exactly connecting with. But um, so red flags and things like that. So again, one of the things is having an outcome. There's no, if you want to go to therapy, and it's, you end up liking therapy, and you end up, that you look forward to it, and you're, you just got a lot of stuff right now. You're working on this relationship breakup, but you know that you got stuff with your brother, you got stuff from when you were a kid, you got stuff from this, that, and the other. Sometimes that's what people do to stay and develop getting better. And then, but again, it's being careful that you're not being reliant. That therapist should be helping you, again, move away from things where you can handle things yourself, whether that is 6 months or a couple of sessions, or whether that's several years, just depending on what level. um I needed a very strong therapist. I needed someone who was not willing to let me utilize all of the psychological information that I was already armed with to manipulate the situation, or whatever. So that was a very important thing, and it was also very important for me to have a therapist that was not only strong, but that had been through a lot of the things that I had been through. So red flag. When you go interview a therapist, and you're interviewing them for a specific reason, maybe it is for sexual abuse. Maybe it was when you were a kid. Again, we always bring up the Uncle Paul, so we're going to throw the uncle under the bus again. So maybe it's an uncle from holidays, whatever it could have been, that you went through. Now, I'm not saying that therapist needs to have gone through that exact same thing, but just because they have a degree which enabled them to get a license through the state to become a therapist, and then they were able to get certified as a sexual abuse counselor, does not mean that they can actually identify with you. That just means they've learned some techniques. They have a folder full of all these little tests you can go through, or questions you can answer, and then they can develop some things for you to go forward with. Again, my experience growing up, very early age 7, watching my mom go through this, practice all through our house for years, all these things, to where then me getting involved in that field, and where I was an administrator for an adolescent residential treatment center for years, in which I hired therapists, managed therapists, the psychiatrists we had on staff, a lot of there was 5 owners, and a lot of them had their fingers in what was going on. So of course they were my bosses, and managed all the mental health techs. We had a horse program. We had all these things. And most of them, the reason they're even in that field is because they are injured and damaged themselves in some way. And a lot of them don't manage themselves very well. And those are red flags. Those are, the overstepping, boundaries, maybe becoming too intimate. And I don't mean physically, I just mean maybe too intimate outside of therapy, or getting off of maybe what's around treatment, maybe sharing too much of that own information of theirs, which has nothing to do with you. The only thing that should be shared is when you're doing that interview, and they're saying, look, I do have experience with that. Wasn't exactly me, but I had a younger sister, or I had this, whatever, and I that was observed, and we went through therapy with it, so I get it and understand it and how the effects it has on people. Again, that's good, solid green light information. Hey, they've just revealed to you that they get it, and they gave you a little information around that. Now, going through that with you, and you guys sitting in there telling war stories, and them going, "Oh yeah, I remember." Oh God, that's not. Those are red flags. And a lot of, unfortunately, therapists use therapy that they're doing with other people sometimes to deal with what's their own stuff. It's a very complicated industry, and it's also designed through education, through certifications, through continuing education things you have to do, it's very, there's not a lot of promotion is to moving the client through to be dealing with on their own. A lot of it is just, it's just this a continuation of this process, because look, therapists don't, they don't bank, unless they're at a specialty level, maybe in a hospital, and they're a little bit older and they've developed a major practice. And usually they can't command rates commensurate with a psychologist, which a psychologist is actually PhD doctor. The difference between a psychologist and a psychiatrist is they both had the psychologist training, the PhD level therapeutic training, but a doctor also went through a psychiatrist went through medical school. So they have that component, and that's where a lot of why medications are prescribed at that level, because doctors and everything are taught to prescribe medication for the industry and just all of the support that they get, and that's how they make a lot of money. So therapists at that level don't, and it's very important that they keep a stable of patients to maintain whatever there is they're doing in their life. They're no different than anybody else, but but it's just like anything, just like a doctor. Yes, they can do amazing things. Look, they've taken that education and they get being able to open somebody up and do a heart surgery and do all that and save somebody's life. But that does not make them your superior being. And therapists, same thing. You have to remember they're there to give you help and techniques around things. And it's your job to be open and active with making sure you're accepting the information, following things, and that it all works. Because they're not going to kick you loose. That's going to come down to you. Again, hopefully that answers some of those questions. I know I'm not giving too many specific points, but it's just very important that people take care of themselves when looking for people to help them take care of themselves. That going on right now. First of all, you can't drive somebody's mental health. You're never going to be able to. You can't, unless they're a child, unless they're under adult age, and you are still responsible for them, of course. And then you can make decisions that sometimes maybe they may not be mature enough to, and things like that. But if we're talking about adults, talking about friends, coworkers, partners, any kind of relationship and whether you're even talking a kid or a adult child, talking about a parent, or vice versa. So if that conversation comes up and that person is participating in it at all, or they've asked for some advice, or they've come to you just talking to you about things, not necessarily about going to therapy, but talking to you about some struggles and things like that. And then you bring it up and it's maybe resisted, or I didn't want to go that direction. I don't need to do that and all that. Years ago, I would have let them off the hook. I would have tried to fix it for them, like try to find out what was the resistance. And then I would jump in there and help navigate that. Well, I don't have time to go see somebody, or I can't find anybody. I don't know who to get. Well, let me take it. Let me look into that for you. Find some people for you. Get you set up and everything like that, and go from there. Bad. That's just a bad way of doing it. What I do now, and what I feel is more appropriate, even if I'm dealing with somebody I really love and really me pushing that narrative a little bit may affect the relationship a little bit, or become more challenging than it is. It's like, look, I can't do it for you. And here's the thing. You're in pain right now. You keep saying you don't see it, but you're screaming and yelling. You're very, very angry. You say it's compartmentalized. It's not affecting the rest of your life. And maybe you don't see it right now, or maybe it's not, but the chances are high that it probably would. Just I'm just trying to speak from experience. And you have to deal with these things. And if you're not able to control yourself in attempting to deal with these things, this is where therapy is amazing. Find somebody to help you understand more about what's happening and things that you can do to deal with it better. But you need to do that. People don't latch onto things. People really, really don't get motivated. People really, and when you do things for people, and you always have, they have a tendency to let you and want you to do that because that soothes them in some ways a little bit, or that again lets them off the hook. They don't have to think about it and deal with it. And most of the time when you do that, they don't follow through with it. So what I would say to someone, around this stuff, and why not? Why not? Why not take the measures to feel better, to be in a place where when maybe it gets triggered in the future, or to be able to hold on to maybe an important relationship with a family member or whatever. I don't know what it could be, but right now, this is not effective for you. And it's certainly not effective, for anybody else that's around you. And you can think this is the one of the issues with a lot of people, especially even younger people. They don't understand what's happening. And that's when that's why they don't understand that it's oozing out on everybody else. That's why they may say that thing that they wouldn't have said normally, or they might do something, or they might participate, or they might drink more, or they might choose to self-medicate, whatever, do different things that they're not connecting at that moment, that keeps them from feeling and dealing with and healing and forgiving so that they can move forward. So a lot of times this is where you hear, in the addiction world, is hitting bottom. You can't keep somebody from hitting their bottom. You can keep rescuing them. You can keep enabling them, doing things for them, putting a cushion down before they fall. You can do all that, and all you're doing is prolonging it. And if you're really good at you grow into that person where it just kept getting prolonged, and you had people enabling you, or not willing to go to the mat to help push that for you in a different direction, you're going to get good at it. And you're going to get good at it like I was good at it. I grew up in that world. I grew up in that field. I watched it. It works. I know it works. I had all the information in the world. But also at the same time, the same person I was getting that from was very inappropriate, very unethical, managed things in a completely wrong way a lot. And so you learn how to do that, and you learn how to take all that information just like anybody else would with information they had in any industry they were. If it was dysfunctional, you learn how to manipulate that information. So a lot of people in that world that have a lot of psychological information will manipulate things, situations, because they can. I was one of them. I was just like a high functioning addict. I think I've talked about it before. A high functioning addict, say an alcoholic, can still wake up in the morning, go to work. They can still somewhat maintain the connections and relationship in their life. Uh, it, and it's just a slower death. It's just a slower emotional, mental crash. And but eventually it would get to that point. Same thing with me. I was a high functioning victim, and I could I could, you know, manipulate situations. So I'm not sure why I got off on that, but it's just you have to recognize things. Again, I'm not. Again, a lot of therapists don't like when I talk like this because they've had I've had some interactions where they feel like it's it certainly keeps people from therapy or that it's just not industry standard. And it's just again it's industry standard from everything I've seen from working in it for years and watching a parent and still knowing that those things go on and things like that. So therapy is important. Therapy people need to engage in, um, and otherwise you're gonna just hone your skills until you crash and burn. And the earlier you do anything, the earlier you engage in anything when it's an issue or a problem in your life, is always going to be best. And so, guys, in saying all these things that I've talked about, look, we have one of the people that we work with on the show. Excuse me, one of the companies called BetterHelp, and this is again online therapist where you can schedule, according to your time and things like that. It takes all of the resistance out of taking that step because you can do it right over the computer. You can do it over the phone, on your phone, whatever. Schedule appointments. You are able to switch therapists. Go through some of those motions if you need to find the right one. I mean, I talk about it in here in an ad for the company, but I only work with companies that I believe are beneficial. There's a lot of cognitive behavioral therapists in there. And again, utilize that and no excuses, really, really no excuses. If you feel like you need to take that step, it's only going to benefit you in what you're working to deal with. And it will accelerate it and it will, you'll learn to be your own therapist through the process. That's the goal.